Anastasia, good afternoon.
Hello, Kati. Good afternoon.
How are you?
Fine, thank you. How are you?
I'm good too. We're still having a lot of people connecting. This is very cool. I see actually a lot of people from Poland. I'm so excited. Dzień dobry wszystkim. Also, I see people from Philippines. I see Canada. That's really nice. That's really nice. Some of them like, Greece. Hello, PP. How are you? I think we can be starting little by little. We can maybe connect the presentation. Today we will be showing you our new product launch. The products for the home care, for the home peeling. They're called Home Resurfacing Peels. As we will be not only like peeling but also like restoring the surface of our skin. So it's super interesting as we are focused on the different dermatological problems. Some of them chronic, very complicated to treat. These products are designed to maintain the results that are achieved in the doctor's place. Also, if you have any questions, you can make the questions through our chat. We will answer them in the end. Today, the webinar will be performed by Doctor Anastasia Lapsyna. Anastasia is our key opinion leader. She works with Innoaesthetics products for many, many years now. She's a practitioner, international speaker, medical director for Ukrainian distributor Totis. So please ask questions if there are any, and I hope you will enjoy the webinar. Thank you very much for connecting. And I know it's complicated time for all of us, because some of you maybe are having lunch and some of you are just maybe in a dinner already, but thank you very much for connecting and enjoy the webinar.
Thank you, Kati. Good afternoon, everyone. Today we will discuss the new product in portfolio of Innoaesthetics. And actually, this is very interesting topic, and the product is really very demanded, I guess, because usually we get some questions of our patients. Do we have something that we can offer them in order to maintain the results that we can get in the clinic? So they are interested in some semi-professional product that they can use at home, that they can give them very fast results, and at the same time they want this product to be safe, of course, because we cannot just give them something that we are using for professional treatment. Just for this purpose, Innoaesthetics Laboratory formulated specific home resurfacing peelings that we can offer to our patients to use at home, and we can be sure that the results will be really great, very fast, but at the same time, never we will get any kind of complications, and it can be completely safe. So why do we use HRP, and what results can we get? First of all, this is the enhance of the results of our professional treatment. So it means that usually we will recommend to use HRP after our professional treatment. And in most cases, it is not enough to use just HRP. So if you're going to use just them without any professional treatments, it can be like maintenance of treatment that was done before. You will see later that the main ingredients of HRP would be completely same with the ingredients of the professional treatment, but here we have lower concentration of acids in order to be sure in the safety. And of course, this is the part of Innoaesthetics line that you perfectly know. So what are the main advantages of this line? First of all, this is the effective protection of the oxidation. In this way, we can protect our cells from the action of free radicals. This is also the neutralization of the action of free radicals in cells. This is also the control of inflammation, which is very important, especially in the prevention of the chronic aging. That is why this HRP is not only the solving of the main dermatological problem, let's say. This is also always an anti-aging treatment. Stimulation of epidermal renovation. This is also like a prevention of the aging of the cells and skin. Strengthen the self-defense of skin, which is very important, especially in the treatment of sensitive skin and skin prone to rosacea. Slow down the aging process. Stimulation of synthesis of collagen and elastin. It means that we will improve the quality of skin. This is deep hydration for the skin that can be used for both oily and dry skin. This is renovation and detoxification of the skin. And after using of this peeling, we always will get the effect of luminosity and glowing skin. So what is the presentation of HRP? It is evaluable in specific packs for 1 month usage. Mostly you will see sensitive redness and acne peels in ampules. There are 8 ampules of 2 milliliters in xerosis, and there are 4 ampules of sensitive redness and acne peels. We have 8 ampules of xerosis because, as you know, xerosis is the product that we have to use in 2 steps. And normally the recommendation of using is 1 ampule per week. If we are talking about hair scalp peel, that would be 8 vials with applicator. So later we will discuss how we will recommend our patients to use every kind of HRP. And first of all, let's start from sensitive skin. We discussed already that mostly this is irritated skin, which is prone to tingling sensations, sometimes pain or pruritus, and there are specific triggers which can cause such kind of reaction. Mostly these are physical triggers, which can be UV radiation, heat, cold, wind, so it can be weather, for example. It can be chemical triggers, mostly this is cosmetics, soaps, pollution, physiological triggers like stress, and hormonal triggers, for example, menstruation cycle. So that is why we usually say that women's skin is more prone to irritation. And for example, before, let's say 10, 15, 20 years ago, it was really like that. So mostly women suffered from different kind of sensitivity or irritation of skin. But now more and more men are our patients, and they also say that they have some kind of sensitivity. And maybe it can be associated with the fact that men started to use more cosmetics. It means that they have more of chemical triggers for their skin to be irritated. So mostly we understand the triggers, but it is very, very difficult to evaluate them from our everyday life. Because if the person is living in the country with a lot of sun, or if it's vice versa, very cold place with a lot of wind, we cannot say that our patient can evaluate the triggers. So in this case, we have to find some kind of treatment for home. We have to find some kind of professional treatment that really can calm down skin and make it not so sensitive towards the triggers that can cause redness. What can be the main factors that can lead to the sensitivity? So first of all, of course, it's different changes in the epidermal barrier. which depends on the lipid composition. That is why if something is happening with the lipids of the superficial layers of the skin, always it will cause some kind of sensitivity or hyperreactivity of the skin. This is also can be the reason of the transepidermal water loss, for example. That is why sensitive skin is usually prone to dryness. So that is why we also need to hydrate such kind of skin. It is also related to dysbiosis of the skin microbiota. And we also will talk about the products which will help to recreate the microbiota of the skin. And we have to work, of course, on the lipid concentration of the stratum corneum and of the superficial layers of the skin. During the diagnosis of the sensitivity of skin, we will have some subjective symptoms and objective symptoms. Talking about objective symptoms, it's much easier to see them. So when the person comes to you for a consultation, they usually say that, you know, doctor, recently I cannot use my common creams that I could use before, or I've noticed that I have a reaction after cleansing of the face, for example, even if I cleanse my face just with during the contact with water, I've noticed that I have some burning sensation, some redness, and so on. And sometimes when these patients are coming to you just during the visual contact, you can see that the skin is rough, there is a little bit maybe of exfoliation, or there is no exfoliation because maybe this is just the beginning of the process of irritation. And at that time, you will just see some redness, especially in the middle part of the face, especially in the cheek area, in the chin area. By the way, chin area, we saw a lot of patients with irritations during COVID, after COVID, because for a long time we used masks. And it was really a big issue for our patients. After different kinds of treatment, we saw that the rehabilitation of the chin area is not the same as in the different areas of the face. So all of these symptoms were objectives, and they were associated with mask, for example, which was physical trigger of that period. But sometimes diagnosis is not so obvious, and then symptoms could be subjective. Subjective means that when you see the skin of your patient, you cannot see any kind of erythema, you cannot see exfoliation, dryness, or dehydration of the skin, but your patient will say that they have really itching sensations, burning sensations. Sometimes they have pruritus. They will say that it's not possible for them to use any kind of cosmetics because after that they have these unpleasant sensations. And in this case, you have to do some treatment to your patient. It doesn't mean that you have to do peeling or something like that, but you can do like specific tests. You even can cleanse the skin of the patient, to try it with water, to try it with soft or deep cleanser, because there is a difference, and deep cleanser contains 1% of glycolic acid. And you will see, do you really see some objective symptoms, or you don't see anything and your patient just have specific sensations? In the case where you really will see objective symptoms, then okay, we understand that this is sensitive skin. But in the case when you don't see anything, you even sometimes can apply a little bit of superficial peeling, like sensitive peel, like xerosis peel, somewhere in the area of nasolabial fold, which is considered to be one of the most sensitive areas on the face, and you don't see redness, then in this case, try to understand the psychological condition of your patient. So maybe your patient is in the case of stress, let's say. So in these cases, sometimes the better result you will get if you will ask for a consultation of a neurologist, for example, who will recommend to your patient to have some relaxing treatment, treatment which will calm down nervous system, so something like that. And it is not the case of the dermatologist or beautician, let's say. But in the case of real sensitivity of skin, we have some issues with the skin barrier. We can say that the barrier is thinner, and because of that, different so pollution, bacteria, and all the triggers can affect our skin more easily. In this case, we have hyperreaction of nerves and things because they are not protected by the lipid barrier, also which have to protect the skin, dermis, nerval endings, and so on. And also, you will see that mainly the symptoms of sensitivity of skin are vivid in the chin area, cheeks area, so mid-face, and mostly in the middle part of the face, so not in the lateral areas. What treatment should we recommend to our patients? So it's really not so easy because it's not the treatment that we can start in our clinic. This is mostly the treatment that our patient has to start at home. So first that we recommend to our patient is to evaluate all kind of chemical triggers that can be in his everyday routine, like soaps, cosmetics, and so on. But at the same time, we understand that our patient needs to use something. That is why for the first period, around 1 month, we are recommending our patient to use just sensitive cream. As you remember, sensitive cream contains hyaluronic acid and panthenol. So this is can be like a diet for a skin. We are hydrating skin. We are calming down the skin, but at the same time, we do not have any kind of triggers that can cause irritation or erythema. Also, if you remember, sensitive cream is in the jar with the specific membrane on the top. So this is also the advantage of this cream, that your patient just have to push a little bit the membrane and they will get the cream. So there is no contact between the fingers and the product itself. It means that not the bacteria, pollution, and so on will not get into the cream, which is really, really very crucial for the patients with the sensitive skin. And of course, we have to try to avoid topical steroids in the treatment of such kind of patients, because the result after steroid creams are really very fast, it's very effective, but as you know, after such kind of treatment, we can get this problem back, and even in the with more severe symptoms. So the recommendations about the treatment is to start treatment at home, then to use cream and to use sensitive cream and to evaluate other triggers. And in a month, you can start your professional treatment. Professional treatment would be using professional sensitive peel and sensitive ID, which we need to strengthen barrier of the skin and also to hydrate the skin. And after this professional treatment that usually lasts for between 4 to 8 weeks, because one of the concepts of the treatment of sensitive skin is to do bigger intervals than we usually do with the normal skin. It means that if with normal skin, we usually invite our patient for a treatment once a week. So here we will invite our patient once in 2 weeks, maybe depending on the sensitivity and irritation of the skin. And after that, after your professional treatment, you can recommend your patient to use sensitive HRP at home, which is the home care or home treatment, semi-professional home treatment for your patients with sensitive skin. And also, of course, this is rejuvenation because, as we've already discussed, here we also have antioxidant action. Here we have protection of the cells from free radicals. Here we stimulate the renovation of the epidermis. So in any case, you also will get the improvement of the quality of skin. Here you can see the main ingredients that we have in sensitive HRP. This is gluconolactone 10%, 2% of lactobionic acid, and 1% of pantothenic acid. Actually, this is the same ingredients that we have in the professional product, which is sensitive peel, but twice less. So in the professional peel, we have 25% of gluconolactone, 5% of lactobionic acid, 5% of pantothenic acid. And the pH of product is rather high, and it's the same in the professional product and product for home use. So it means that, of course, you will not get irritation with such high pH. So why we have these ingredients here? First of all, gluconolactone, for example, and lactobionic acid. The main action that you will get is the effect of hydration and also very, very potential antioxidant activity because of the possibility to give the effect of metal ion chelation. So it means that we protect our skin from the damage which can be caused by ions of the iron, for example. Also, we will block lipid peroxidation, which is also the protection of the membranes of the cell. We will inhibit this process in any case. We will block the processes of oxidation of the fatty acids. So mainly, we will get really very, very strong antioxidant effect. Gluconolactone is has the specific action which is similar to the action which can be caused by glucose. So in this way, we can bind water and we can save this water in the upper layers of the epidermis, which is very crucial for the skin, which is prone to transepidermal water loss, because we know that we do not have any blood vessels in the epidermis. All the blood vessels that we have are in the dermis. So epidermis can get water or from the atmosphere or from the dermis due to the specific proteins which are called aquaporins. But the next step is to hold this water or to bind this water. And if there are if the lipid barrier of the epidermal layer is damaged, then it means that our epidermis will not be able to hold this water. Just specifically for that, we need some ingredients. Normally, they could be the ingredients of the natural moisturizing factor, which is responsible for holding this water inside the epidermis. And just specifically for that, we will use gluconolactone for hydration and also for calming skin. And not only gluconolactone will give us this effect, we also will use lactobionic acid. So lactobionic acid, on one hand, is a very, very strong antioxidant. On the other hand, this is like the part of natural moisturizing factor, like lactic acid, for example. It means that it will bind water in the epidermis, we will hydrate the skin, and we will prevent transepidermal water loss. In this way, all the enzymes of the skin will work properly, because in the case of dehydration of the skin, our our proteins, our enzymes, which has to destroy the binds between the cells, which are called desmosomes, they are not working. If these enzymes are not working, if they are not destroying desmosomes between the cells, it means that these cells of the stratum corneum that should be exfoliated and removed from the superficial layers of the skin, they will stay on the skin. That is why usually touching the skin, palpating the skin, you can feel roughness, you can feel some exfoliation of the skin. That is because of the dehydration, and that is because of the deactivation of our proteolytic enzymes. So I will return a little bit to the specific action of the gluconolactone. So we've discussed that it has calming effect, it has hydrating effect, and also it can regulate sebum production. That is why sometimes gluconolactone is also used for the oily skin and for skin prone to acne. Here also, I would like to pay your attention that sensitive skin can be dry and can be oily. So not always sensitive skin will be dry. Later, we will talk about xerosis. Yes, in the case of xerosis, we are talking just about dry skin, and never you will have oily. But in the case of sensitive, skin can be oily, skin can be dry. And for example, rosacea, this is the type of oily skin which is prone to redness, and also this is sensitive skin. So gluconolactone in the case of oily skin will help to balance the production of sebum. So we discussed lactobionic acid, and also lactobionic acid is the inhibitor of metalloproteinases. Metalloproteinases are specific enzymes which are responsible for the destroying of some structures, like, for example, old collagen fibers. And sometimes we really want to stimulate our metalloproteinases for the degradation of the old collagen. But if we have hyperactivity of metalloproteinases, and this hyperactivity can be caused, for example, by UV radiation, in this case, these metalloproteinases will start to damage not only old structures, they will start to damage also new and young collagen. So that is why in this case, we have to protect the skin from the action of free radicals that will stimulate metalloproteinases. And also we can use ingredients that can inhibit the activity of metalloproteinases, and actually lactobionic acid has this activity. So using sensitive HRP, we will get antioxidant effect, hydration effect, we will increase the storage of fibers and glycosaminoglycans like hyaluronic acid, for example, and we will improve the quality of stratum corneum, and we will stimulate the process of keratopoiesis. The third ingredient that we have here is panthenol, which is also a provitamin B5, and panthenol possesses calming activity. It restores the skin barrier activity, it moisturizes, soothes the skin, it possesses anti-inflammatory properties. It also it can penetrate deeply and stimulate the proliferation of fibroblasts. So this is really very great ingredient for the treatment of hyperreactive or sensitive skin. So how we are going to use, how we will recommend our patients to use sensitive HRP at home. First of all, they have to cleanse the skin, of course, with soft cleanser. In the case of irritation, after cleansing the skin, they have to put the content of the Innoaesthetics sensitive HRP ampule into the jar which is already in the box with the product, and apply 1 or 2 layers for some minutes. So usually first layer we can apply for 1-2 minutes, and the second layer we can apply for 5 minutes, for example. It would be completely enough. So of course, for not sensitive skin, for not irritated skin, it's possible to use it for longer time, but while we are working with the sensitivity, 5 minutes will be completely enough. Also, don't forget that your patient are using that at home, and this is actually mostly time-depending product. That is why 5 minutes is okay for your patient. So after that, the patient have to rinse it with water, and finally, at the end of this semi-professional treatment, we recommend to use Innoderma sensitive skin cream. We have already discussed this cream. It contains only hyaluronic acid and panthenol, so there are no any kind of triggers which can stimulate the irritation. And after this treatment, the jar should be washed because it will be used for the next treatments. And the interval between the treatment is usually 1 week. So the concentration of active ingredients is really twice lower than the professional sensitive peel. That is why if professional sensitive peel, we recommend to do once in 2 weeks or in 10 days. So sensitive HRP can be used once a week. The next dermatological problem or skin that we are going to discuss is dry skin or xerosis. So here, this is the problem of really dry skin. We are not talking about oily skin. And here, sensitivity would be, or irritation, is like a secondary symptom which was caused by dryness. It's very important to understand because very often doctors ask me in what case they have to use sensitive products and in what case they have to use xeroskin products, because their action is very similar, and we have both of skins can be irritated and so on. So sensitive skin can be dry and can be oily, and sensitive products we can use for both types, but the main symptom is redness, is erythema, itching sensations, and we are working with that. We are working with sensitivity. With xerosis, skin is always dry, and this is the most important, lipid barrier. We have to restore lipid barrier, and with xerosis we can have sensitivity, or maybe there is no sensitivity. So sensitivity is secondary. It's just like the symptom which was caused by the damage of the lipid barrier. This is the main difference. So xerosis, the main symptom of it is dry skin. Usually we can call it xerosis, we can call it xeroderma. And this is the condition of the skin which was caused by the deficiency of the hydrolipid barrier. This condition is characterized by the reduction in the amount of the quality of lipids or the changes in some lipids. And also this is the condition which was caused by the lack of the natural moisturizing factor. So actually, in order to understand how natural moisturizing factor is important for our skin, try to remember the skin of patients with ichthyosis. This is a very severe genetical disease, and the skin is looking very dry. It's always exfoliating. It's really damaged skin. So this is the genetically the main reason of this disease. Of course, one part is some valuation of genes, but this is the lack or total absence of the natural moisturizing factor in the skin. So this is what natural moisturizing factor is doing. It's responsible for binding water in epidermis, for hydrating epidermis, and also for normal work of our enzymes responsible for the destruction of the binds between the keratinocytes, between the corneocytes also. There are objective and subjective symptoms. The objective symptoms are very easy. You can see dry, flaky skin, dull skin, usually grayish skin. There is loss of elasticity that was caused by the lack of hydration. There are a lot of wrinkles, more superficial or deep wrinkles. The subjective symptoms, you cannot see them, but usually your patients can say that they feel tightness of the skin, especially after contact with water, after using some cleansing gels. They also can have burning sensation. They have some kind of maybe irritation that you can see, but here irritation and sensitivity is secondary. So for such kind of skin, we will recommend our patients to use at home Xeroskin HRP. As you remember, I will show you for professional use firstly. So what we have to recommend our patients to do it first. First of all, we will recommend them to use Xeroskin creams. We have day cream, we have night cream. So our main and first goal is to restore skin barrier. And after the restoration of skin barrier, we can start to do professional treatment in our clinics. And one part of that professional treatment is professional Xeroskin peel. And you can see two steps of this peel and the main ingredients. And the other part of the treatment is mesotherapy treatment, which is Xeroskin ID, which helps to hydrate the skin, which helps to have really great moisturizing effect. So after your professional treatment, which is performed in clinic after 4 or 8 weeks, you can recommend your patients to use product for home care, which is Xeroskin HRP. As you can see, the concentration of the first step is completely same, but really these are very, very gentle ingredients, and the pH is really high. It's between 4 and 5. So never you will cause any kind of irritation. But the second step, where we have acids, here, yes, the concentration of the active ingredients would be much lower. So these are the formulation of the Xeroskin HRP. We have here lactobacillus, which are very important for the restoration of the microbiome of the skin. Bromelain, leuconostoc, and in the second step we have lactic acid. Again, remember that lactic acid is the part of the natural moisturizing factor, gluconolactone. We have already discussed it, which possesses moisturizing activity, and mandelic acid. So mandelic acid is a very, very strong anti-inflammatory ingredient. So lactic acid promotes keratopoiesis. It stimulates epidermal hydration because it's the part of natural moisturizing factor. It also shows the some antioxidant activity because it can protect our skin from the damage which can be caused by UV radiation. And mandelic acid mostly it has anti-inflammatory properties, which is very, very important for the dry skin or the skin with xerosis. It has the activity to inhibit the process of synthesis of melanin. So it inhibits melanogenesis, which means that we prevent any kind of post-inflammatory hyperpigmentation. But here we have just 2%, so we can be sure that this treatment is completely safe. So yes, there is little risk of irritation, but we are using this product just for around 5 minutes, and we have very low concentration of mandelic acid. So actually, never you will get, never you will cause sensitivity or get irritation. And of course, this is the product that can be used all year round. And gluconolactone. We've been already discussing gluconolactone, so I think we are not going to do that second time. How to use this peeling? So you remember that Xeroskin HRP has 2 steps. It means that we will have 8 ampules of, we will have 4 ampules of step 1 and 4 ampules of step 2. First of all, we recommend to cleanse the skin with soft cleanser. Then we have to apply the second step for several layers. Usually you can do it for 2-3 layers, and the time of exposure of the first step can be between 2 or 3 minutes. So after that, we can rinse it with water and apply the second step. The second step we can apply in 1 or 2 layers, and the time of exposure of the second step is 5 minutes. Finally, we again have to rinse or cleanse the skin with water. We have to cleanse the jar. And at the end of the treatment, we recommend our patient to finish it with applying Innoderma Xeroskin cream. Again, the presentation of the Xeroskin cream is the same as the sensitive skin. So it has the specific membrane on the top of the jar, and your patient just have to press it in order to have the cream. So they do not contact with the fingers with the product all the time in the jar. This treatment we will do during 4 weeks. We can do it, your patients can do it once a week, and it's very easy. And it will help to hydrate the skin, to improve the quality of skin, and to improve the appearance of the skin, to not to have this grayish color, and all that symptoms of dehydrated skin. So the next product we are going to talk is the product which AKN HRP, which is recommended for the patients with acne. Of course, this is not the main acne treatment. This is just the support and maintenance of the treatment which you already are performing in your clinic. So as you know, talking about acne, this is a specific skin condition which is characterized by the sebum retention and inflammatory changes which can be caused by acne bacillus. The pathogenesis and physiopathology of acne can be divided into 4 main steps. So first of all, this is the excessive sebum production. This is also hyperkeratinization with the clogging of the follicles with the products of keratinization and also sebum. After that, this is bacterial colonization, because the conditions in the hair follicle are very good for the development of Propionibacterius acne, because this is like anaerobes, and in the case of keratinizations, there is almost no air in the hair follicles. So for Propionibacterium acne, this is perfect condition. And of course, at the end, this is the release of the inflammatory mediators that can be released by bacterium, and also they can be released by our skin, especially in the case when the hair follicle is damaged, and all the process is happening not just in the follicle, but also around the follicle. So in the case when we have not papules or pustules, we have already cysts. This is also the risk of post-acne scars and so on. So now we are not going to discuss all the treatment of acne, because this is really the topic of of another webinar, and this is the topic that we can discuss for more than 2 hours. But if you already started your professional treatment of acne in your clinic, if you already recommended your patient to use products for home care like AKN Day Gel and AKN Night Gel, you also can recommend your patient to have some semi-professional treatment at home, like AKN HRP. So pay attention to the concentration and active ingredients that we have here. These are mandelic acid, salicylic acid, and pyruvic acid. So these are the same ingredients that we have in the professional AKN peel, but twice less. And the pH of product is higher than the pH we have in AKN peel. So what the main activity, what the main effects that we are going to have from these active ingredients? Of course, the main ingredient is mandelic acid. And we are using mandelic acid in acne-prone skin because of its activity in terms of inhibition of the like anti-inflammatory properties, antibacterial properties, lightening effect, because sometimes we need to prevent hyperpigmentation, post-inflammatory hyperpigmentation. Sometimes we already need to treat post-inflammatory hyperpigmentation if we already have post-acne hyperpigmentation, for example. Salicylic acid, which is very, very strong keratolytic, but here the concentration is not very high, so don't think that you will get some kind of exfoliation after this peeling. You will not get. And also this is the ingredient which will regulate the production of sebum in acne-prone skin. So salicylic acid here is just like keratoplastic. And pyruvic acid, which is on one hand, this is an exfoliant agent, but we do not have high concentration of it here. And also pyruvic acid is always like the source of energy for all the processes that we are stimulating in our skin. That is why all these processes that we are going to stimulate, they will just happen faster. The protocol of treatment. So here, as you can see, for the cleansing of the skin, already we can use both soft and deep cleanser. And of course, if the skin is oily, if the skin is not sensitive, yes, it's better to use deep cleanser with 1% of glycolic acid. Then we have to use the content of the ampule of Innoaesthetics AKN HRP, put it into the jar, and to apply 1 or 2 layers over the skin with the cotton swab. We have to leave it just for 5 minutes to rinse it with water, and then at the end, pay attention that we are going to finish it with Innoderma skin repair. So we are not going to use AKN Day or Night Gel, because as you know, AKN Day and Night Gel are the products which contain acids. So of course, after this home peeling, in order to soothe the skin, we are not going to use any kind of acids, and we recommend to use the product skin repair, which we recommend to use for the finishing of most of the treatments that we are doing in our clinic or we are recommending to do at home. And again, it's necessary to cleanse the jar. So acne treatment again can be done every week, once a week. It's very gentle, but at the same time very active. Rosacea skin. So rosacea is always a sensitive skin, but oily skin. And there are different subclinical or clinical subtypes of rosacea. There are 4 of them, and beauticians, dermatologists, aesthetic doctors usually work with the erythema telangiectatic rosacea. So we are not working, or papulopustular also. We are not working with the ocular rosacea, which is the case for ophthalmologists, and we are not working with the fimatose rosacea, which is mostly the indication for a consultation with a surgeon. Talking about rosacea, what are the main triggers, factors that we have to understand? So first of all, this is sensitive skin, and again, the process of rosacea is a neurovascular process, which is associated with the hyperreactivity of some kind of receptors that hyperreact towards some triggers, and the triggers can be the same as in the case of sensitive skin. It's like chemical triggers, physical triggers, but also in this case, this is ultraviolet, which is the most active and important trigger, and some food like spicy food, some alcohol. So this is also the substances which can activate these TRPA receptors. So in this case, after activation of these receptors, the substance P will be released, and also would be activated our macrophages that will reveal histamine. So this is like some kind of, so like visually it can be it can looks like some allergic reactions, the sense of warmth, redness of the skin, but itching is very, very rare symptom in the case of rosacea. So with rosacea, again, we need some professional treatment, which is not easy. And we usually in our clinics, we have to use some treatments which will give us soothing effect, treatments with the effect of strengthening of the walls of the blood vessels, because here we also have to treat our capillaries. So at home, we are recommending to use redness HRP, which contains salicylic, mandelic acid, lactic acid, and azelaic acid in the less concentration than the professional peel. So salicylic acid is only 1%, which is twice less. Mandelic acid, again, twice less. Lactic acid and azelaic acid, twice less, and the same pH. The protocol of treatment would be almost the same, but before protocol of treatment, why we have these ingredients? Salicylic acid possesses anti-inflammatory activity and also keratolytic effect. But of course, in this situation, when we have just 1% of salicylic acid, never you will get any kind of exfoliation after using redness HRP. Mandelic acid we are interested in because it has antimicrobial activity, anti-inflammatory activity, and this is not the sensitizing ingredient. And lactic acid as the ingredient of the natural moisturizing factor, we needed to promote epidermal turnover. Also, we needed to hydrate the skin, to moisturize the upper layers of the skin. And azelaic acid, which is very, very effective in work with rosacea, because its anti-inflammatory properties are very high. So that is why azelaic acid we use not only in the cases of rosacea, as you know, we can use it in the cases of acne for such kind of patients. It also prevents post-inflammatory hyperpigmentation. And here it's very important because rosacea is associated with the chronic inflammation. So that is why azelaic acid here is really one of the most important ingredients. Very easy to use the product. Again, we have to cleanse the skin with soft or deep cleanser. Rosacea prone skin is usually oily, so it's not a problem if your patient will use deep cleanser at home. We have to use all the content of the ampule which we have in the box, and to apply it with a specific swab that we have in the box, which applies peeling very, very gently. We need to apply peeling just for 5 minutes. We can finish the treatment with skin repair, which possesses regenerative effects and soothing effects, and we have to cleanse the jar. The interval between these home treatments is 1 week. I also would like to pay your attention that in the box there are specific swabs for the applying of the product. So pay attention of your patients or of your clients that they have to use it. So don't use just cotton swabs, because here it say cotton swab, but no, we apply a specific applicator that we have in the box. If they will apply just a normal and original normal common cotton swab, it will be more traumatic for the skin because of these mechanical movements. So for home care and for sensitive skin, don't do that. Just apply everything that you have in the box. This is really very, very important. And the last but not the least product that we have in this HRP portfolio, this is the hair scalp peel for flaky scalp. So as you can see here already, we don't have ampules, we have vials, and normally 1 vial is for 2 treatments. Here you also can see that there is a specific applicator, which is very, very easy to use. So in what cases can we use this product? We can use it in the cases of seborrheic dermatitis of scalp. We can use it in the case of dandruff or alopecia. Again, this is the product which helps to maintain the treatments that you are performing in clinic. The main ingredients of hair scalp peel HRP are salicylic acid, resorcinol, panthenol, biotin, pyroxene, and selenium sulfate. The main activity of each ingredient. So salicylic acid is keratolytic. That is why we will stimulate the processes of exfoliation in order to regulate them. We will stimulate epidermal turnover, which is really we need while stimulation of keratinization, and antimicrobic activity. Resorcinol is also a keratolytic product and helps to renew epidermal layer. Biotin or vitamin H is very important coenzyme which we need to the processes of metabolism. And also biotin is commonly used in the cases of seborrheic dermatitis because it increases the synthesis of fatty acids. Panthenol is a very powerful soothing ingredient, and usually it is used in the cases of dry skin, in the case of erythema, pruritus, roughness on the skin. It also helps to improve the hydration of stratum corneum, which is crucial in the cases of seborrheic dermatitis, for example. There are some clinical trials which were conducted with 50 patients, and these patients were with some hair loss. So after 8 weeks of using of panthenol, it was noticed the reduction of the hair loss and also the improvement of the overall hair density. Piroctone is the specific ingredient which is also commonly used in the case of hair loss. It's very active and potential ingredient. It has the activity to reduce erythema, to reduce also some burning or itching sensations if patients have them. It has antifungal effects, which is crucial in the treatment of dandruff, let's say. It doesn't have any kind of adverse reactions, so it's completely safe treatment. And selenium sulfate we need in order to reduce irritation, and also we need this ingredient in order to eliminate the infected stratum corneum. Actually, this is the idea of treatment of dandruff, of treatment of mainly dandruff. So the main indication of the hair scalp peel are seborrheic dermatitis, and also like an additional product in the treatment of alopecia. So of course we understand that this is not the main treatment of alopecia, where we need the inhibitors of 5-alpha reductase and so on. But after your mesotherapy treatment, let's say 8 or 10 sessions of hair loss control, you can recommend your patient to use hair scalp HRP at home during 8 weeks. Also, you can recommend it to your patient to use during the periods of telegenic alopecia, like autumn, beginning of autumn and beginning of spring. It can be used by both, by men and women. So, of course, psychological treatments are also challenging. And we have webinars, we have trainings about trichological problems, about alopecia, telegenic, androgenetic alopecia, women and men, how to treat them, the difference between TDS products, Hair Vital, and hair loss control. But all kind of diagnosis will include differentiation between different hair types. So you have to understand if it's oily or dry hair type. We have to evaluate the condition of the hair follicles, and usually for that purpose we need to work with a trichoscope, which will show us, do we have vellus hair, do we have some kind of pigmentation in scalp area. It will help us also to evaluate the amount of the healthy hair and weakened hair, the amount of hair with the tendency for loss. So there are different tests like pull test also, which will help you to understand if it's really alopecia or not. So there are also some blood tests, anamnesis. So all of these tests, questions, anamnesis, it should be done by the first consultation with your patient. Then you decide what kind of what diagnosis you have here, what kind of treatment you are going to perform in your clinic. And after your professional treatment, now you also have some supporting treatment that your patient can perform at home, and this is hair scalp peel. So this is the protocol of treatment. At first, we need a little bit to moisten hair scalp. Then the patient has to apply product on the scalp, just like part by part. it's enough to use half of a vial, because one vial is for 2 applications. Then after putting it on the scalp, they have to apply it with like massage techniques to leave on 10-15 minutes, and after that they can rinse or they can clean this area with water and shampoo. This is enough. So this was the basic information about HRP products that we are going to use at home. If you, and it of course will help the doctor to really have full care or full treatment for the patients, both in clinic and at home. If you have any questions regarding products we were discussing today, so please, you can write in chat. If everything is clear and right now you don't have any questions, but maybe you will have them later, so you always can contact with Innoaesthetics, with Kati, and she will resend these questions to me. Kati, we don't hear you.
Sorry. I just realized. No, I think you just need to try the product on yourself. I think there are great products to support the doctor's treatment. And also, if you don't have any like specific chronic disease, I think that maybe now when we're changing the season, for example, you can check what kind of the skin disorders you might have even by yourself without having, it's like not like a complete chronic disease, but something like it times that it comes with the season, like for example the hair loss. You can, for example, support your treatment with the HRP peel for the hair loss. For example, if you can have maybe a bit more in during the winter, the redness when you are changing the temperature from the hot temperature inside of the places and go out when the temperature is lower. You can also help your skin to have better effect. And as Anastasia said, all the peels, they have also anti-aging properties. So you can have really nice plus for the home use. I hope you tried it. If you have not, just please do it. Let me see. The breastfeeding. Can breastfeeding women use the products? We have one question.
Yes, it's possible to use for breastfeeding women because the concentration of active ingredients is really very low, and mainly we are affecting just the superficial layers of epidermis, and we are working with the stratum corneum. The only thing that you have to remember and explain to your patient that there is a specific hormonal disbalance in the breastfeeding women, pregnant women. So that is why the effect that you will get may be not so good and full like the effect that you will get from the patient in the other period, let's say. But if you need, you can use it.
Okay, so thank you very much, Anastasia, for today. We will see you in the next webinar that we will be having. The next one that is programmed already. I will be informing all the distributors will be about InnoCE product, about all the products that we have with the InnoCE mark. There are 7 different products, very exciting. So I hope you will be with us too. And thank you very much for joining us today, and see you next time. Thank you.
Thank you. Bye. Have a nice day and see you.